Yeah, anti-malaria treatment has been tried to treating the COVID-19, like hydrochloroquine, which is the Trump he used. And but this treatment now, the quinine is anti-malaria, has been used for try to treating the COVID-19. But recently, the FDA revolted this, saying this has no effects, and also there's a serious side effects. So this being revolted, this permission, urgent use. But in Africa, in Madagascar, and they made a tonic. The tonic supported by the president of Madagascar. And they using the tonic, the main ingredients is Artemisia, and plus some of the herbs in Africa. They provide this tonic to their school children and provided by the population, other populations. And even the neighboring country, they're also using this tonic. And whether this really reduced the spreading of the COVID-19, there's no statistical analysis to tell that. But it seems because the study in Max Planck Institute of Denmark and also German, the Free University, they together studied this. They find it can stop the COVID-19 virus replication in the living cells.
So Dr. Zhang, just to recap, because some people came on, for people that that cannot get vaccinated for health reasons, and perhaps even those that are vaccinated and don't want to get the variant, one capsule of allicin that melts in your mouth, it bypasses the stomach so it doesn't upset the stomach, and you just let it dissolve in your mouth. And are you also saying to take your Artemisia is okay, and how many a day?
Artemisia has not been clinically studied.
Right.
And this is an in vitro study. So compared with the in vitro study, clinical usage, now they are doing these two units, the institutions, they are doing phase 1, phase 2 clinical trial. Because we don't know whether the blood concentration, when we take this like artesunate in our body, can reach to the concentration needed to stop the replication, the cell lines. And so in the body, the situation is much more complicated than the cell culture. So therefore, we don't have any conclusive, the conclusion, right, saying this definitely can work.
But to boost your immune system, it can't hurt. You're saying we don't have any conclusive evidence with COVID, but you've used it for many different co-infections and it's worked.
Yeah, it's a anti-malaria, anti-babesia. Anti-malaria is confirmed because this work has been winning 2015 Nobel Prize.
Right.
And also it's an anti-cancer. It is studied by Seattle, the Washington State University. And their publications find this can suppress 14 cell lines of cancer. This work has been confirmed by National Cancer Institute. So this is quite definite. It's useful. And for anti-malaria, we borrowed for babesia because they have similarity. Babesia and the malaria protozoa, they're using a redox reaction to replicating the protozoa. Cancer cells also using the redox reaction to replicating the cancer cells. So therefore, they have a similarity of mechanism, so that the Washington State University found it is good for 14 different cancer cell lines. And this work has been confirmed by National Institute of Cancer. So I think this is quite have a solid scientific base. But for COVID-19, it is not. It's
Right.
only in the very early stage, it's an in vitro study, but it also has in vivo clinical usage. Algeria, in Northern Africa, Algerians, they use it to compare with hydrochloroquine. They find that this is better than hydrochloroquine.
That's a big endorsement then.
That is in Nigeria, not Nigeria, Algeria. That's in Africa also. Why they know this more than us? Because they have malaria. So they know this substance much better than we know here.
Dr. Zhang, what are your thoughts on ivermectin?
IV?
Ivermectin, have you heard of, it's another anti-parasitical drug that they say works very well as a preventative for COVID. It's called ivermectin.
That I'm not, I didn't
Okay.
read about this. But another thing what we use is the HH, the Houtonia herba. And the doctor, there's the article about this, it says it can also suppress the replication of COVID-19, but there's no detailed study.
But even though we know it's not conclusive, I just want to go over this for everybody. Dr. Zhang is saying it is somewhat conclusive to take 1 allicin a day and let it dissolve in your mouth, because it protects all the membranes where COVID attacks first and then goes into your bloodstream. You might smell funny, but it also bypasses the stomach, so your stomach is not going to be upset. And then for the HH and the Artemisia, how many should we take just for, I know you're not saying it's COVID, but how many should we take for immune protection?
Artemisia is the pharmacological study showing it is effective for anti-malaria. The dosage is, the first day is 200 milligrams. After first day, 200 milligrams, then 100 milligrams per day.
Okay.
But for malaria, it's very quick. Malaria only needs 1 to 2 weeks. But for Babesia, it needs a few months. And for COVID, we don't know. I think that it's, if it, just like the multinational study showing, it can stop the COVID-19 cell, the virus replication in the cell, then I think at least this can reduce the virus load in the body if we cannot totally eradicate it.
And Dr. Zhang, the HH is this, did you say it's petunia? It's
Houtonia, yeah, Houtonia herba.
And is that 1 capsule a day for immune or 2?
1 capsule, it should be 1 capsule 3 times a day.
1 capsule 3 times a day of the HH, which is the petunia, and then 1 dissolvable allicin, and then the Artemisia is 100 milligrams a day. So do you feel that this COVID and the variants is something that will die down? Or what is your thought about this
You know, this virus is quite mutable. Up to now, it's already have 4 to 5 different variations. Now the new variation is called the lambda. So that's we cannot predict how long it will with us. But I think that because we are doing so much study, we understand it much better than before. So that besides prevention using vaccination, and also now we can find some therapeutic curative treatment for it. If we combine these two sides, I think we can control it. It's like in England, although people have 55% of people vaccinated. And so even they got the virus again, but these people, the disease will be mild and also death rate will be very low. So here with the UK and Indonesia, this is the rate. I think that means the vaccination works. And then plus some treatment, if we develop some treatment, to curative treatment to stop the virus replication, and that would be very good. I think we can end this pandemic.
So I know a lot of people that are very scared to take the vaccine because of their stories they have heard or things that have happened to their loved ones. They're very scared. And so understandably, so at least your protocol of Allison and Artemisia and HH, along with the vitamin D and zinc and quercetin, which is shown to be effective against the virus, at least they could protect themselves. I think I don't think people don't want to take it, they're afraid because.
I think that the severe side effects is very rare, not very common. The most severe side effects, one could be a sudden death, like the intravascular coagulation. And this can be prevented by even taking simply taking aspirin, and also our circulation P formula can preventing the intravascular coagulation. Those are the most serious side effects, which can cause stroke, cause lung infection, cause kidney infection, and this can and a heart attack. So this is one of the most serious side effects.
So
another serious side effect is myocarditis. That means the heart muscle inflamed, and also pericarditis. That means the peripheral capsule of the heart inflamed. And this can be treated later on by using suppress the autoimmunity, remove the immune complex, and reduce inflammation treatment.
Dr. Zhang, if someone's getting the vaccine, how much circulation P should they take before they get the vaccine?
The dosage is 1 capsule 3 times a day.
1 capsule, and for how long before the vaccine would you say?
Just 1 day before. Maybe.
Oh, 1 day.
And then aspirin, the baby aspirin.
So do you think that people should take 1 baby aspirin every day anyway, or just for the vaccine?
For young people, probably not. For like a middle age or age higher, like more than 60 years old or 70 years old, 1 day, 1 baby aspirin is good.
And just for health, how how should people take circulation P and what does it do?
Circulation P is a general health support. It's not particularly treating any particular disease, but it's overall improve your body's transportation, and you're improving your tissue and cells blood supply. In this way, improve your general health. Of course, in Chinese medicine, we say that pain caused by blockage of blood circulation. So to make blood circulation smooth is the main method to release pain. So that is why we often using circulation P formula. And it also traditionally used for treating DIC, diffused intravascular coagulation. So this is a very good substance, and it also anti-fibrosis. One of the sequelae of COVID-19 infection is caused lung fibrosis. So that it can be used for reverse fibrosis.
Oh,
We've
wow.
been using it for treating liver, like the hepatitis caused fibrosis and the cirrhosis. Using this can help to reverse it, can dissolve, absorbing the scar and make it the fibrosis less. And this has been used for treating silicon lung, like the miners, they're digging in the mine and their lung has a lot of dust. That the dust lung can cause fibrosis. And this can be treated by circulation P and the cordyceps.
So overall health, people should take at least 2 circulation P a day, if not 3, depending on their.
You know, Chinese medicine is a health maintenance medicine. We believe a good health is the main healing power. So therefore, we are not particularly aiming certain disease. We make your body healthier. A healthier body can heal itself much more effectively. I myself has been taking it for more than 30 years.
I know, and it shows. What about the vitamin B? If you guys could mute your phones. So someone just came in. If you could mute your sound because you're on the screen and we want Dr. Zhang up on the screen. The 914 number, could you mute? Dr. Zhang, what about, some people were asking about the vitamin B3.
Vitamin B3 is a precursor of NAD+. It metabolizes in the body, turn into NAD+. NAD+ is also called coenzyme 1. This is the enzyme our cell organ, mitochondria, used for producing energy, ATP, for cell functions. When the cell function getting better, your fundamental body function improve. It also corrects DNA mistake. DNA mistake happening all the time because in any moment, our body has trillions of trillions DNA replication happening. This replication make mistakes. This mistake accumulated is a disease, is aging. So correcting DNA mistake can fundamentally improve the body's biological function and can release aging, cause some change, and also can cause disease, cause the change. And the disease radiation and aging can cause DNA mistake that can be corrected. Therefore, it can prolong life and make the aging much more healthy to avoid the aging-related disease like a tumor, like a cardiovascular problem, like a dementia. So this is a very good substance.
How many a day?
I suggest people to look at this book, to read this book. This book is very good. It's a lifespan, and you can buy from Amazon.com, $15. And the author, David Sinclair, who is the researcher in Harvard, and he has a very clear explanation of the molecular mechanism of disease, molecular mechanism of aging. So,
Guys, please mute.
very good for you.
So, Dr. Zhang, just want to recap. As far as the NAD, is it one a day that's effective?
Our body's ability to processing the precursors of NAD+, including the vitamin B3 is niacinamide, also the NMN, and this precursor of body's capability to processing is 3,000 milligrams per day.
Oh, so
we can do 1,000 to 1,500 milligrams per day.
oh, so
niacinamide is every capsule is 500 milligrams. You can take 2 to 3 capsules a day. That is way still in our body's capability to handle. But be careful, niacinamide has 2 kinds. One kind can cause hot flashing, and that is not good. So be sure when you buy it, the bottle has to clearly say it is flashing free.
it is what free?
Flashing free. Hot
Flashing free. Okay, flash is, and that's the one that you have, right?
Yes.
So I know, Dr. Zhang, a lot of people are coming in late, so I'm going to just recap one more time, and then we're going to ask questions that Dr. Zhang is actually in favor of the vaccine because of the Delta variant that he said is more serious and transmittable, but he does have things you can take to avoid some of the possible consequences, like circulation P a day before, which would head off any kind of possible, clot or stroke or coagulation. But if you don't want to, Dr. Zhang recommends taking one garlic, one of his allicin, and he's renowned for this. It came out during the AIDS epidemic, and keep it in your mouth till it dissolves, because it will absorb in your mucous membranes, which is where the virus, the COVID, tends to, that's where it attacks. So that's one a day, along with the Artemisia, which is 100 milligrams a day, just not for COVID per se, but it will keep your immunity up, along with the HH, which is another a supplement for your well-being and for the immune system. So and then we talked about the NAD. Dr. Zhang, is there a difference between NAD and NADH?
Yes, different. NAD plus is especially it's an enzyme in the mitochondria, and NADH is not the same as NAD plus.
Okay, and some people say they feel a lot of energy when they take the NAD. Should they cut back then?
This energy, because it made the mitochondria can make more ATP for the cell to function. That is why it's energetic, to make people more energetic.
Okay, so I want to open this up to questions. I know we talked a lot about Dr. Zhang's products, which you can get from me, but more importantly, that whether you're taking the vaccine or you're not, Dr. Zhang's products will help you, will help your immune system, will help you to stay healthy with or without the vaccine. And So I'd like to open this to questions. Terry, how much NAD to start? I think Dr. Zhang said 15, is it 1,500 milligrams a day?
Yes.
So it's 1,500 milligrams a day, Terry. So who would like to ask a question? Just ask away one at a time.
I would like to ask something. If you're keeping garlic in your mouth, shouldn't you also sort of have it in your nose, because the coronavirus can enter the nose and into the lungs, 1, 2, 3. So isn't that also an issue?
Because the allicin has a very small molecular weight, it's evaporating. It's like a smell. So it's besides in the mouth, it also goes to the nose. As the mouth nose, there's a channel connected. It also goes to the sinus.
It does. Okay.
Yeah.
That's good to know. Thank you.
And the one thing I like to emphasize that why the Delta variation is so dangerous. Before we say the coronavirus is spreading by air capsules. Air capsule means when you're sneezing, you're coughing, you're breathing, there's a small particle of this water come out in your breathing out or coughing out. Those will contains the virus. This small particle of the water is considered as a capsule. So because this is a capsule spreading, so keep a social distance and 6 feet and wear mask would be enough. But Delta is not air capsule spreading. It is air spreading.
Oh, wow.
So it is much more spreading, much more fast in a much wider range of the space. So if you are in the same space as a person carrying the virus, you will be contacted. Some people even went close with a person, just a very short moment. In this kind of short moment, in a few seconds, you can get the infection. So this is quite contagious. Before the alpha and the beta, one person can infect 2 persons. But the delta, 1 person can infect 4 persons. So that I think this is why I think right now to get the vaccination is important.
But can you still get the Delta virus through your eyes? Because I always protected my eyes thinking they're a mucous membrane with the coronavirus. So is the Delta available still to get it through your eyes?
Yes.
Okay, thank you.
But
Okay.
you know, the eye and
Eyes.
the nose and the mouth are also connected.
Yeah,
The tear tube is, you can get into the eyes.
I always wore glasses when I go inside. Okay,
And
thank
also
you.
the wear mask is still important. Now, even advise people after vaccination, when you go to public place, wear mask is still important.
Dr. Zhang, if someone gets the Delta, what's the first things they should take or do, like right away?
I can say myself, if I got to test positive, I will increase my dosage of allicin. I will take ATM, and also I will take HH.
How much allicin would you take as opposed to one preventatively? How much would you take if you actually got it?
1 capsule 3 times a day.
Got it.
Allicin's active ingredients, it's the molecule very small, and the pharmacological studies.
Guys, please mute. Sorry, Dr. Zhang.
The pharmacological studies showing the effective treatment dosage is 1 milligram to 2 milligrams per kilo body weight. So 1 capsule 3 times a day is 75 milligrams, good for 75 kilo body weight. That is 165 pounds. And so most people are around this body weight. So we suggest that 1 capsule 3 times a day.
Thank you. Dr. Zhang, so somebody asked, what about the possible long-term effects of the vaccine? Does that concern you?
How long the vaccine, the protection can last,
No.
we still don't know.
No, not that. What about the side effects?
The side effects cause 2 things. One is the myocarditis and the pericarditis. And
Right.
those are the autoimmune related inflammation. We can treat it. And another one is intravascular coagulation.
Right.
That we can also treat it.
But what about, people talk about long-term effects of the vaccine on your immune system? What are your thoughts of the mRNA? What are your thoughts on that?
Most of the immune reaction after the stir up by the vaccine, the reaction time is about 2 or 3 weeks. And after this, it should be calmed down. But if we continuously reacting, become chronically immune dysfunction or chronic immune reaction, then we can do immune regulation treatment to eliminating these effects.
How?
Most of these cause the long-term infection, the effect of the vaccination is caused by prolonged extensive inflammation, which is caused by immune complex. The immune complex is made from antibody antigen complex, plus complements cause inflammation. So if we can remove the immune complex, then this can be under control. We have the way to remove the immune complex.
I mean, sorry, how do you do that?
Using the AIM can reduce the antibody production, production. Using the circulation P can promoting phagocytosis of macrophage to ungroove the immune complex to remove it.
So, Dr. Zhang, the AIM, which is like a steroid, right? It's an anti-inflammatory.
Yeah.
That should not be taken around the vaccine because it will stop it being effective. But should that be taken a couple of weeks after the vaccine if people are feeling inflamed?
The vaccination producing antibody needs 2 or 3 weeks. So during this time, you don't take this suppress the autoantibody production, or antibody production treatment is not good. But after these 2 or 3 weeks after the second shot, then if you have some side effects showing, then you can use it to treat.
Dr. Zhang, someone said that pregnant women are not advised to get vaccinated. What's your feeling about that?
What?
Women that are pregnant.
Yes, pregnant and underlying condition and immune deficiency, these are not advised to take it because this has a higher chance to cause severe side effects.
So when you say immune deficiency, does that mean someone that has had Lyme or someone that's had, what constitutes what is immune deficiency? What conditions? Is it diabetes, Lyme, like what?
Immune deficiency means the lympho cells like CD4, CD8. This is cellular immunity.
Oh, guys, you got to mute your phones, please.
Yeah,
Sorry.
this cellular immunity, when it compromised, that the count will be lower, like in Lyme disease, CD57 quite low. That means the cellular immunity compromised. Then the ability of producing antibody compromised. That means your body lack of proper ability to producing antibody. That is a humoral immunity compromise.
I think Willa needs to go
So,
on.
so Lyme disease, having had Lyme, guys, please mute. Having had Lyme,
I can't even understand it.
Lyme can cause immune deficiency, like cause autoimmunity, cause oversensitivity, cause extensive inflammation. This means the immune system is compromised, is dysfunctional.
okay, so Lyme, and what about diabetes? Are you, what's your feeling?
Diabetes is autoimmune in nature. So that means so-called autoimmune, the immune system should be able to tell self and non-self. It protects self, it against the non-self. Somehow this function deteriorated, misfunctional. So take its own tissue as a non-self against to cause it to cause inflammation. In the diabetes, it causes the yeast, the pancreas not to producing the insulin cells being attacked. So the insulin become less secreted, and also the body develop insulin resistance, the antibody against the insulin also. So these are the autoimmune related condition. So diabetic people mainly, they have lots of immune problem.
So Lyme, diabetes, what about Epstein-Barr, somebody's asking?
Epstein-Barr is an opportunity infection. Almost everybody, adult in the urban area, everybody has.
Right.
So-called opportunity infection means when your immune system intact, it won't cause problem. Only when your immune system compromised, it cause problem. Mainly cause mononucleosis and chronic fatigue and immune dysfunction syndrome. And that very similar to the chronic Lyme disease.
So is the vaccine?
Immune dysfunction.
So no vaccine if you have that. Be careful.
Yeah, I think that if not very severe, that I think a vaccine still can be done.
So, and what about if you've had cancer or chemotherapy? Is the vaccine advisable?
The cancer itself is immune deficiency caused, because the cancer development, the precursor is the immune dysfunction. And the chemotherapy is an immune suppressor. So when you're using these, I think vaccination is not advised.
Okay, so just to be clear, if you have active Lyme, if you've had cancer, if you have diabetes, maybe better to do more of an immune boosting protocol than the vaccine. Everyone has Epstein-Barr, so if it's not that active, it doesn't matter. Someone's asking, out of all the vaccines, which is your favorite?
It's difficult to say. I think that right now, the local CVS, they carry, you have to use it. You cannot choose, you know.
No, but I mean, in a perfect world, if you had to pick your favorite, what is it?
According to report, the less bad things happening is the Pfizer and the Moderna.
Yeah, that's what I've heard as well. And somebody wants to know, do you think there will be bad side effects on the immune system years from now that we don't even know about from these vaccines.
That we need time to observe. It's too early to say.
I mean, I think what Dr. Zhang, what I'm hearing you say, which is why a lot of people are concerned, is that if you have immune system dysfunction or your immune issues, immune deficiency, then it's wise to be cautious. And I think that's what people are feeling. But the good news is Dr. Zhang has a great protocol, and I'm happy to go over it if anyone wants to hear it again. But I think I've said it 3 times, but any other questions for Dr. Zhang while we have him? It's very special and rare. Oh, they want to know which one you had, but you don't have to tell us.
I use Pfizer because
Pfizer.
local CVS only have Pfizer.
Okay. Did you ever think you'd see something like this in your lifetime, Dr. Zhang? I mean, you've dealt with AIDS and you've dealt with Lyme, so is this a surprise?
You know, because of the climate change, now we have something that have been frozen for millions of years. They come out now. So I think that the climate change can make some of the dead animal under the frozen, the iceberg,
The
and
glacier.
they're being discovered.
But a lot of doctors say a lot of doctors say that this is man-made and it has some components of HIV. Do you think this is man-made?
I think it is difficult to say. According to Dr. Fauci, and I heard he's in the senator's in the senator hearing, and he said that the senator doesn't know what he's talking about. He said if somebody is lying, the person is you. So that is very clearly, he denied there's a possibility of man-made.
Yeah, I know that a lot of doctors feel it was man-made because of how unusual it is. Does anybody have any other questions for Dr. Zhang? This was extremely, I don't know about for you, it was very informative for me, and I'm very grateful to know about this. Are there any other, I know Dr. Zhang, we talked about the Allison and the HH and the AIM, and there's someone on the phone who has a lot of joint pain. So the AIM is like a steroid, right? Kind of like it's, so how, Jane, that's for you. Like how would they take that anti-inflammatory?
You know, this is a discovery in China in 1960s and 70s. Found some plant polyglycoside that has steroid effects without the steroid side effects. So it has been used for inflammation disease. The joint pain mostly is arthritis, and the muscle ache is fibromyalgia kind of symptom. Those are the inflammation of the muscle and the joints. So the inflammation caused by autoimmune antigen antibody complex. And this substance can reduce the autoantibody production, release the immune complex, reduce inflammation, reduce pain. And this is, so I think most arthritis caused by autoimmunity, the inflammation. So can be used for 2 things we use. One is AIM, another is circulation P.
So, but just for a health protocol, it's usually Allison and HH. And then in more extreme circumstances, like maybe cancer or COVID, is more of the Artemisia. But do you, the Artemisia, do you stay on that all the time, or is it 3 months on, 1 month off? How is it titrated?
It's dependent on what condition. When we are using it for treating babesiosis, we use it for about 3 months time. And for cancer, like a precancerous condition, like a pap smear positive for dysplasia, and that we can use using a localized use as a suppository, and also oral use. This can help to get rid of the precancerous condition like polyps in the ulcerative colitis. Those are being considered as a precancerous condition. And this can be treated with the artesunate by orally, and also some can be localized as a suppository. And then for the cancer survivors, after these cancer survivors, they went through chemotherapy, surgery, radiation, but after this oncotherapy, they still have minimum residual disease. Minimum residual disease means when the oncotherapy finished, in the cancer patient body still have some minimum amount of cancer cell left over there. And those minimum residual disease is the foundation of relapse and the metastasis. For this small amount of the cancer cell, we cannot using chemo because it's too toxic. So we can using artesunate to get rid of this minimum residual disease to preventing relapse and metastasis. And I have a patient, her name is Margaret, named Margaret in Maine. She has a liver cancer. She has been with us for 15 years. Now her liver lesion becomes scar. Then I told her, I said, now we can stop the treatment. She said, I don't dare to. Then I told her, I said, then we do 1 month on, 2 months off, 1 month on, 2 months off.
Say that again, 1 month on what, Dr. Zhang?
1 month on, 2 months off.
Got it.
Yeah, because it's just a prevention for possible any residual cells still there.
How much would you take of that?
1 to twice a day.
One. Wow. And Dr. Zhang, are you're still, if anybody wants an appointment, are you seeing people on Zoom, right?
Yes,
Dr. Zhang?
on using telephone, it's online. Yeah.
That's so great. You're such a wealth. Oh, wait, someone has a question. Oh, well, I think he answered that. Someone said if you have mitral regurgitation, a heart valve issue, when you get the vaccine, is that when they should take the circulation P?
If the heart valve has some leakage, and that if plus the myocarditis happen, that could be a big problem. But the myocarditis is, the happening rate is very low. So this has to be very careful, I think, just to be careful.
So, I mean, would you get the vaccine if you had mitral regurgitation, heart valve issue?
I probably will using Allison and ART-M and HH.
Yeah. So I'm going to type that in again. This is, instead of the vaccine, it's Allison, HH, and Artemisia. If you guys want to know where to get it, just email me. And are there any other questions for Dr. Zhang?
Didn't understand what product he was talking about to prevent the residual cancer cells after chemotherapy. I didn't understand what product.
RM.
Artemisia.
Oh, okay.
Artemisia's active ingredients.
Okay.
Yeah.
Thank you.
So if anyone wants to contact Dr. Zhang, I will send you the office number. Any other questions? Dr. Zhang, I can't thank you enough. You're just so generous. And again, it's great to see you looking so wonderful. And if anyone wants to have an appointment, Dr. Zhang is available. I thank you so, so much. And all of our best wishes to you and your family.
Thank you for giving this opportunity to talk with people and to contact with you. So if I can be helpful, then just you can call Elaine, and I will do my best.
And we can send you images. If we had a condition, we can send you images before an appointment. Okay, thank you. That'd be great. Thank you. Thank you so much.
Thank you. Thank you, everybody.
Thank you, everyone.
Dr. Zhang.
Zhang.
Thank you. Adios.
Bye, Kim. Happy birthday, Kim.
Thank you, darling. I gotta go check my heart valve now, but we're good. Thank you. I do. Yeah.
Get on the circulation page.
I am. I am. Thank you.
Thank you. Thanks,
Bye,
Barb.
Claire.
Good night.
Good night, Dr. Zhang. Thank you. See you soon.
Thanks, Dr. Zhang.
Thank you, Dr. Zhang.
Bye, everyone. Thanks, Barb.
Bye. Bye, guys.